I welcome you all for this press briefing. This is our second hand surgery camp with Goa Medical College as the host hospital, along with GCAM Switzerland, GCAM Foundation Switzerland. This time we have a bigger team of experts. We have 5 surgeons, one anesthetist who have come to treat our patients. Dr. Yuri, the head of plastic surgery department and department of orthopedics under me. We have selected almost 50 to 60 patients for this camp, and these are the rare cases of hand problems in our state of Goa, and we are going to do somewhat different kind of treatment. This hand surgery camp is the dream of our Honorable Health Minister, Shri Vishwajit Rane. He said we should have a center of excellence in the super speciality block so that we can deliver our best care to those needy people who are suffering from hand problems. Now, normally you will say what is so great in hands, but there are certain diseases like congenital deformities of hand, then rheumatoid arthritis where people are not able to use their hand, and many patients we see in plastic surgery who are having the burns problems, post-burns contractures of the hand, and there are nerve injuries which again requires the expertise, and these expertise are available with us during this camp. Today we have started the camp and we have already operated 4 patients. They are doing very well. They have just finished the operations and they have come for this briefing. So now I would request the team coordinator to say a few words on this combined venture.
Good evening to everybody. So we are here for the second time after 6 months of the first camp that we ran with between GMC and GCAM Foundation. So this camp is the second visit to consolidate the collaboration between the 2 teams to open by the end of first half a hand unit in the super specialty block on the 7th floor, and we will have regular camps, and our experts will visit the premises regularly, and beside that we will also create a fellowship program, whereas our professionists will come and teach to the student of GMC interested in specializing in surgery.
Thank you to you for having us. I've been working with Professor Lanzetta since a long time. We did together the first hand transplant. We were considerably younger. True. But hand surgery, especially such delicate hand surgery as microsurgery, needs a very good collaboration between anesthesia and surgery. And this is what has always been working fine for us. But I must say that the anesthesia people that I met today, both consultants and residents, are excellent. Incredibly solid preparation and very, very much skills. And I appreciate their work a lot, and also the possibility to exchange opinion with them. And I'm sure that for your objective of the Center of Excellence, you have very valuable people in the anesthesia team. That's the main impression I got today.
Today we operated 4 cases. One case which was a malignancy of the hand, one case had a deformity of the hand, one had a tendon injury, and the last patient had excess skin on the arm. One of these patients was the follow-up of the last camp. We were fortunate to have the expertise of Dr. Marco, who's done the world's first unilateral and bilateral hand transplant. So such knowledge and skill are welcome, and we appreciate him for coming here, and we look forward to further sharing of knowledge and expertise.